Good morning, everyone, and you are very welcome this morning to the conference on chronic cough. I'm Helen Parks. I'm speaking to you from Northern Ireland, and it is lovely to be able to join you and to have you attending this morning. Just to make you aware, we have an international audience this morning, and therefore, before we start, I'd like to draw your attention to the simultaneous translation, which is available to you today. You can either use the Wordly app in Zoom or go to the link in the chat box, and this will take you to the site where you can choose your language and be able to read the automated translation alongside the conference page. We hope that this tool will be useful to you, but please bear with us. We understand it will not be absolutely perfect. So this morning, as we come together, I am representing the European Lung Foundation, also known as ELF. We are an organisation led by patients, and we work across the globe to bring patients, the public, and healthcare professionals together to improve lung health. We focus on advancing diagnosis, treatment, and care for lung conditions. And one way we do this is through conferences just like this, where patients can learn more about their own condition and ask questions directly to experts. It's not just about learning from the professionals. Experts can also learn a lot from patients. So please feel free to share your personal experiences and what it is like living with chronic cough. Since 2021, ELF has been hosting these patient conferences, and many patients, along with their families and friends, have told us just how much they've learned and how valuable these events are in helping you as patients feel less alone. It really is a great opportunity to see how dedicated the healthcare professionals are. They want to improve treatments for all. We also recognise that there are many health professionals in the audience today, and they're eager to share and to deepen their knowledge and to enhance their ability to support their patients. I hope you find the conference today both helpful and enjoyable. I know from attending previous conferences just how worthwhile they are, but we also need your input. And at the end of today's conference, we'll send out a survey. So please share your thoughts with us. It's really valuable to us to understand how we can help you more, what you find useful as part of today, and what else we can do as part of ELF to help and support you. So thank you for being here. It's great to have so many people from around the globe joining us. And now I'm going to hand over to our co-chair, Marta Dabrowska. So Marta, over to you.
Thank you, Helen, and thank you all for joining us today. My name is Marta Dąbrowska, and I am a respiratory physician working at the Medical University in Warsaw, Poland. Here, together with my colleagues, I lead a cough center where I have been treating patients with chronic cough for more than 15 years. It's a great pleasure and honor for me to co-chair this conference together with my colleagues Sandeep and Caroline. The conference was organized by ELF Cough Patients Advisory Group and the NeuroCough Group. Helen has just told us about the ELF, and now I would like to introduce Clinical Research Collaboration NeuroCough, which is a pan-European project that brings together clinicians, respiratory physicians, academic researchers, and industry partners interested in chronic cough. The main goal of the NeuroCough project is to improve care and treatment for patients with chronic cough, and to help advance the discovery of novel, better antitussive drugs. NeuroCough leads a pan-European registry of patients with chronic cough since 2022, and at the end of the conference, we will see the update of the registry results at the end. It's very important to listen to the patient's voice, and we try to cooperate with the ELF Cough Patients Advisory Group, and many thanks to all organizers for organizing this conference. And now I would like to introduce my co-chairs, Sandeep Paul Kaur-Pater, and Sandeep, over to you.
Thank you, Matt. Thank you, Martha. Hello, everyone. My name is Sandeep. I have chronic cough, and I'm a member of the ELF Cough Patient Advisory Group. I have been living with cough for more than like 3 years, almost now. Everyone says it's just a cough, no worries about it, but no one knows the impact that it has on the quality of my life. So to say chronic cough is not widely known, but yet it affects so many people worldwide. That's what makes this conference so important. It provides an opportunity to deepen our understandings, explore ways to manage cough, and learn about treatments and the latest research. We have had an incredible response to our conference with over 260 participants from more than 58 countries, and that's really amazing. We're excited about this. This map shows where everyone has registered from. This event is also a great opportunity to connect with others. We want it as interactive as possible. So please say hello in the chat, share where are you from, and ask questions. That's the main point, okay? Right, speakers can't address the personal cases, so don't hesitate to ask. There's no such thing as a silly question. Our goal is for you to gain the knowledge you need. If you're on social media, especially on Twitter, please, and be sure to share your thoughts using the hashtag Cough Conference 2024. The hashtag is Cough Conference 2024. Now, I will hand over to my co-chair, Caroline, who will introduce today's program. Thank you. Caroline, whenever you want.
Hi, thank you, Sandeep. I'm Caroline. Hello, everybody. I have chronic cough, and I'm also a member of the ELF Patient Cough Advisory Group. I've had a chronic cough since birth. As a small child, my mother was regularly criticised for taking a sick child out in public because of it, and I was bullied at school due to it. As an adult, I'm aware of suppressing my cough all the time, and when I'm eating out or drinking out in public, being afraid of choking. Physically, it's tiring, irritates my airways, and causes bleeding in my throat, and has led to broken blood vessels in my face, and pulled chest muscles and vomiting due to it. Moving on from that, there are 2 main sessions in the conference, and Marta, Sandeep, and I will be chairing each session. We will introduce the speakers, keep them to time, and coordinate questions to ask at the end of the session. Time is allocated for questions after each session. Please write your questions in the Q&A box at the bottom of the screen as we go along. We're fortunate to have highly knowledgeable speakers who are leaders in the field of chronic cough and deeply committed to patient engagement. They actively encourage patient involvement in their work and welcome our input. We also want to learn from patients, and throughout the morning, we'll be hearing directly from those who experience cough. Please feel free to post your questions in the Q&A. Remember, there are no silly questions. If you want to ask it, I'm sure there are others that are out there that want to hear the answer. You can also like questions you'd like to be answered by clicking on the thumbs up icon in the Q&A box. This helps bring them to attention and reduces duplicate questions. The first session will look at the consequences of chronic cough. We'll then have a short break before going on to explore current and future treatments for chronic cough. Marta will now explain some of the practical aspects of the day.
Thank you, Caroline. And I would like to give some housekeeping clues. As the webinar is in a webinar stay event, all attendees are on mute and can only see the speakers, hosts, and chairs. But we would like the conference to be as interactive as possible. So we invite you to comment or put questions in the chat or through Q&A board. Please feel free to write your questions. We will try to answer as many as we can in the time we have during the conference. Those questions not answered will be passed to our speakers, and we will try to put the answers on our ELF website for you to access it after the conference. We will also use polls. Some of our speakers have included polls in their presentations. We will be using an application called Mentimeter, and we would try to use it right now. So if you may need to install it in the application Zoom, or you can scan the QR code or type the link. And just to try, we would like to ask you to answer the first question right now. How much knowledge you have about the chronic cough, and feel free to answer the questions using this Mentimeter application. In the meantime, I just remind that the conference is recorded and will be made available on the ELF website after the event, so you can freely access them. And we will give some 3 minutes to 2-3 minutes for everybody to answer and try to use this application. And we will see that somebody has an error on the Mentimeter, so please try to. May we ask in a few minutes to show the QR code once again? But we'll see that many of us has some knowledge about the chronic cough, but there are still a lot of patients who feel that their knowledge about chronic cough is not enough, not sufficient, and so it emphasized that we need some conferences dedicated for patients to broaden the knowledge, to say more about the chronic cough, and we are sure that the speaking with patient's voice, with emphasizing or focus on the patient perspective, is a key method to help other people, other doctors to understand and recognize the problem of chronic cough. If I may ask to once again to show the QR code for Mentimeter show the link to the Mentimeter for those who couldn't use it. And now it's time to begin the sessions, and I would like to hand over to the Sandeep.
So now I would like to introduce our first session where we will discuss the consequences of chronic cough. First of all, we would like to share a short video of patients talking about how having chronic cough affects them.
3年的时间，我一直到现在就是每天的不间断的咳嗽，每一天。然后在我在我治疗之前，我几乎是从早到晚不停的咳嗽。
Assusta a maior parte das pessoas que estão comigo, porque efetivamente ela é tão intensa, e já não me assusta, sou habituada a ela, mas ela é tão intensa que acabo por, como disse há pouco, vomitar, não é expectoração, mesmo vomitar da intensidade do esforço, por vezes sem uma espinha na urina, porque é mesmo muito forte.
影响就是慢性咳嗽对于我在生活上的影响。毕竟作为有朋友、有家人的社会群体、社会个体，就是我。然后呢，加上有时候我出去，如果说偶尔，但是
Die Leute erschrecken immer. Normalerweise bekomme ich ganz gut Luft durch die Nase, aber nachts, sagt mein Mann, hätte er den Eindruck, dass ich durch die Nase schlecht Luft bekomme. Ich würde immer durch den Mund auspusten und es klingt, als wenn ich Luftballons aufblasen würde.
Ficava por mim mudar, porque a minha tosse é cavernosa, as pessoas ficam ali, mudava-se que a tosse muito forte. E às vezes leva-me a vomitar, tão intensa que é, mas a nível pessoal, em casa, as tias não bem com a minha tosse. Mas o que mais me custou na altura foi, a nível de trabalho, de na sala, com as 3 ou 4 pessoas, e eu sei que a tosse acabou por perturbar as colegas, porque é mesmo uma tosse muito intensa. E isto é um efeito que tem muito impacto na vida das pessoas. Saber se foi uma pessoa que não é um local que fique envergonhada, que está com tosse, junto das pessoas. De facto, eu não fico mais chateada por incomodar as pessoas. E não consigo desligá-la, não é?
Ist natürlich sehr unangenehm mit dem Husten. Ich habe als Lehrerin gearbeitet, wenn Stille war, Kinder haben ein Gedicht aufgesagt, musste ich husten.
Estava por afetar também as duas colegas de trabalho. Nesses dias eu optava muitas vezes por ficar em teletrabalho, para não incomodar.
训练的时候，周遭的人也会对我投来相对异样的眼光。还有一个主要，我认为还是心理健康上的一个困扰。毕竟慢性疾病了这么多年，我的心里很难说一点焦虑都没有。
我突然的这个咳嗽就被激发了，然后我当时其实是戴着口罩，但是还是造成了一些周围人的恐慌。我能感觉到他们有一点惊吓的看着我，然后他们会慢慢的撤离去其他车厢。我当时现在其实非常的不好意思，就是给大家造成这样不必要的误会和不必要的困扰。从那之后呢，我其实会尽量避免去这样密闭的公共场所。然后如果实在要去，我心里会有一点焦虑，有一点担心，会想说
Auch wenn ich im Zug fahre, habe ich das Gefühl, dass die Leute eigenartig gucken, besonders nach Corona. Wenn ich mich unterhalte mit Freunden und Bekannten, muss ich auch ständig das Gespräch unterbrechen, weil ich husten muss. Die wissen das schon, aber sie lästern oft über mich. Schämen tue ich mich nicht, aber es ist mir unangenehm. Ich würde auch gern öfter ins Theater und ins Konzert gehen, aber ich habe immer die Befürchtung, dass dann so ein Hustenanfall kommt. Und was mache ich dann?
应该说也算是多产的焦虑，因为我会担心我的这个慢性疾病以后会造成对我生命的威胁。毕竟我目前为止，因为慢性咳嗽也导致了我的肺功能在下降。我也知道，肺是全球死亡率前3的一个慢性疾病。我也会担心，就是这个慢性咳嗽发展到后面，我会。
Thank you to the patients who took part in that video. I'd like to acknowledge their bravery and openness in sharing how the condition affects them. Now it gives me great pleasure to introduce the first speaker, Kaylee Brindle, who will be discussing the impact of cough. Kaylee is a senior respiratory nurse with a particular interest in chronic cough. She works in the cough clinic in Hull in the United Kingdom and is also pursuing a PhD exploring the impact of chronic cough on patients. Over to you, Kaylee.
Thank you very much, Caroline, for the lovely introduction. I will just share my slides. Lovely. So thank you for inviting me today. It's a great honour and privilege to be asked to come and talk on something that I'm extremely passionate about, which is the impact of chronic cough. I'd like to extend my thanks to ELF, to the NeuroCough Initiative, and to the patients who have put together this fantastic conference today. And I really hope that we all can learn something from it. So I'm going to be talking about the impact of chronic cough in an area that I'm really passionate about, which is the importance of the patient voice. And it is hoped today, as we go through this presentation, that those listening understand that chronic cough is just so much more than just a cough. And it's actually a really complex condition that affects people in many different ways. And actually, for those of us treating and caring for patients with chronic cough, we have to ensure that we have individualised holistic care. So we look at the whole aspect of how it affects patients' lives. And this can only be achieved when we listen to our patients. So for anybody out there who has a chronic cough or who lives with anybody with a chronic cough, I'd like to just say that the most important message today is that your voice matters. Now, in my opinion, the experts in chronic cough are the patients that live with it. And I would like a little bit of interaction with you today. So I would ask that you scan the QR code or you link onto the link that's showing on the slide. And I'd like you to tell me the impact your chronic cough has on your life in 1 or 2 words. And I would really like as many of you as possible to type that in. Now, there may be some of you that cannot describe the impacts of your chronic cough in 1 or 2 words. And if that is the case, I would still like you to interact and just put the word no into the presentation. And hopefully in a second or two, we may get the correct poll on the screen. So I can see in the chat, somebody has just put pain, which is a common occurrence when I'm in the clinic. I'm not sure if we can share the slide with the analysis. I can see debilitating and embarrassment. I think if anybody is unable to use, I know we can't see the screen as planned, but just type in the chat how your chronic cough impacts you. So we've had a few words. I'm going to reshare my slides if that's okay. And look at actually what the literature tells us about the impacts of chronic cough. So what we do know is that chronic cough impacts 10% of the population. There is some variation in different areas over the country or over the world. And we know that we have people from all over the world tuning in today. It is a condition that affects females more than males. So approximately 70% of patients that attend our clinic will be female. And it has a significant economic impact. We know that people struggle to work. There's a cost burden of repeated prescriptions. And what we do know is when patients do attend a specialist clinic, such as the one that I work in, often it's over 4 years before they are referred to a specialist service. They've been misdiagnosed, they've had frequent hospital appointments, frequent testing, and they attend the clinic and often they say nobody understands the condition. So when I've had a look at the literature and when my patients were repeatedly telling me that nobody understands, we come across, and this is just an example of a review. And what does that tell us about chronic cough? Well, it tells us that our patients, they have depression, anxiety. There's often an underlying worry that there's something sinister. They've got maybe an awful underlying condition, that it affects their relationships. Cough is a very explosive sound. If you live in the same household as somebody with a cough, anybody in that household will be impacted. Our patients report pain. They may have sore ribs. It may give them headaches. And it affects their sleep, so they may feel tired. A lot of our patients are female and they have urinary incontinence. We will be hearing a talk about urinary incontinence a little bit later. And it affects their career. They struggle to work and they feel socially isolated. And what we do know is that comes with an impaired quality of life. And on this graph, so this was a Korean study where it looked at the quality of life with patients with chronic cough. Now, I want to draw your attention to the graph at the bottom. So the grey line will represent the quality of life in chronic cough. So the lower the bar, the more impacted the quality of life is. And this is looking at particularly patients over the age of 65. And we know in clinic that the average age is often 60 to 69. So these are our patients we see regularly in clinic. And we can see that they have a poorer quality of life, perceived quality of life than people with arthritis, people who have suffered a stroke, and people who suffer with respiratory conditions such as asthma, and is comparable to conditions such as chronic obstructive pulmonary disease. So we know this evidence is out there in the literature, but constantly patients are telling me nobody understands. I've seen 5, 6, 7 healthcare professionals and nobody understands. And I think that's where my passion about the patient voice, because that is impactful, but that doesn't tell the full story of chronic cough. So I, as part of my PhD, did a project where I looked at the literature to see where the patient voice was. And we found there was actually, at that point in time, very little. And these qualitative, so what in research we talk about qualitative as asking patients questions and they're giving them the answers. At the time, there was only 6 studies, and not all of them had talked about experiences. So I set about looking at, actually, if I pick out what are these patients telling us? And what I found was it was much more impactful and what my patients were telling me every day in clinic. Now, often patients is perceived as it's only a cough. So patients will tell us if it was cancer or something, people would look for a cure, whereas this is, well, it's only that you've got a cough. We know that it's a condition that affects people in many different ways. It's retching, it's struggling for breath, it's vomiting, nose running, headaches just with the coughing. And this isn't just something that happens once a day, this is something that happens constantly throughout the day. And it affects what we call in nursing activities of daily living. So eating and drinking, sometimes I choke while I'm eating and I choke when I am drinking and I cough even more. And even elimination, going to the toilet, I literally have to go to the bathroom or I might go in my pints type of thing. And it's not just pee, it's the opposite. And the cough completely consumes people and takes over their life and becomes their identity. They don't know me by my name, but they know me by my cough. And it has some quite devastating consequences. So this patient explains how actually the cough was so bad that they fractured 2 ribs. And then our patients describe not only having a constant cough, but the constant worry that goes alongside this. They report social isolation. So it's affected my social life. I did nothing all summer but cough, feel bad and sleep. And it's annoying. I'm always worried about going out and about, and what would I do if I couldn't stop coughing again when I'm on a plane or a train? And there's a stigma attached with that because obviously people don't understand that these individuals have a problem. So they think that they're a big walking germ. And I think we can all agree since the COVID-19 pandemic, when cough was one of the main symptoms, that stigma has got significantly worse. It infects people's careers. People feel like they're a nuisance and they don't want to go to work anymore. And I think we often underestimate as healthcare professionals the impact it has on the significant others. So those that have a really close relationship with individuals living with a chronic cough. So this is an example. My husband was sitting staring at me, waiting for me. I felt like he was waiting for me to die. And it was like, is she ever going to get her breath back? And the embarrassment that not only the individual feels, but that they feel their partner has, it must embarrass him, but he never lets on. He just turns me in and cuddles me in as if, protecting me from the world. And these patients with chronic cough generally feel like there is no light at the end of the tunnel. They don't see being able to see light at the end of the tunnel where it's going to be, oh, it's okay. I can't see it ever getting better. And they've seen multiple healthcare professionals and they know they've exhausted every avenue, but unfortunately they still live with this cough. And they feel that although they've seen multiple healthcare professionals, they've never offered a solution, and often it's just more of the same. And actually that healthcare professionals are just following the protocol they have been given. We know that chronic cough patients feel desperate. You are willing to sort of grasp at anything. If they told me to hold my head underwater for 10 minutes a day, I would do that, And that actually in 18 years, their cough has never changed. And unless a miracle occurs, they feel like they will have this cough till they die. Now, what we do know is actually there has been a lot of fantastic research in chronic cough, and I do generally believe there's some light at the end of the tunnel. Now, I'm sure the medication gefapixant will be familiar to a lot of you on the talk today, as it is the first licensed treatment for chronic cough. There are other compounds currently in clinical trial phase, which Professor Maurice will talk about later in the talk. And it's hoped this will provide a more effective option compared to other therapies. Now, I am really passionate and think it's important that we will need some real world evidence to truly understand the true impact it has on individuals in clinical practice, and the patient voice can absolutely be utilised for this. So I want to give an example of some work we've been doing locally where we have done this. So we did a real world study where we assess the clinical response to gefapixant in the real world. And it has to be accepted that randomized control trials, which is the trials that I've been involved in for the past 11 years in chronic cough, have very strict criteria, and often they report the outcomes using questionnaires. So within the clinic, we initiated 12 patients on gefapixant, and we assessed their response after 1 week. And we did it firstly in a normal way using questionnaires. So you will see on the graph that their quality of life improved, that they reported less cough frequency, less cough intensity, less wheeze, and less breathlessness. But what was really interesting to me is that didn't really truly reflect the true impact that it had on these patients. So I asked patients to write down in their own words the impact the gefapixant had on their cough over the period of that 1 week. And this is why the patient voice matters. Because what the patient told me, if we think back to the social isolation, is that the biggest event for them that week was that they had company and they got through the afternoon without coughing and felt able to join in the conversation. That for the first time in years, they were able to attend a funeral and just be in the moment and not have to worry about where they're sat and not having to worry about if their cough disturbed anybody. We think back to the incontinence. They told me that they hadn't coughed so much that they'd vomited or wet themselves. And actually that they were now having 1 coughing per day. And that itself is interesting because that patient had perceived that the reduction in the bout of coughing had had a significant improvement. And when we think about the physical and mental impact, this patient reported that prior to this, I felt in so much pain and they did not want to be here. So the side effects, so anybody familiar with gefapixant, it can disturb their taste, were minimal in comparison. And another reported that they felt like they could cope where previously that they were at the end of their tether. But it's also important that there were, work impact. So there was also important that they felt they could work. So their cough wasn't impacting on their cough anymore and they felt a lot more controlled. And in regards to the taste disturbance, surprisingly, most patients told us that they were adapting to the taste disturbance and they were prepared to live with that because the reduction in the cough had had such an impact on their quality of life, as we've seen in these quotes. But it didn't work for everybody, and that is important to know that for those patients it did. They were desperately disappointed as they'd been following the development of gefapixant and all they had is loss of taste and it didn't do anything for them. So I hope this has highlighted the importance of the patient voice. And I think it is probably fair to say it has been neglected. We are getting much better at that, but I would advocate anybody living with chronic cough or the significant others to understand that your voice truly does matter. And actually for those that work in chronic cough research, we should be advocating and using the patient voice to educate others on this awful, debilitating condition. Thank you.
Thank you, Kaylee. It was a very interesting and very impressive presentation. I totally agree with you that the patient's voice is the clue that we need to broaden the knowledge of chronic cough. So it's so important to listen to the patients, to their voice. We also know that we need further progress in finding novel cough drugs because there is no one drug for everybody, and the management of patients with chronic cough is very complicated. It needs a little more than one drug it's a holistic approach. And knowing about the consequences, about the complications of chronic cough, we would like now to go to the second presentation, and I would like to invite Dr. Angela Rantel. She will be speaking about the cough-related stress urinary incontinence. One of the complications that is underestimated or underreported due to embarrassment, but we definitely need to speak about it because it's very important. Dr. Rantel is a consultant nurse in the urogynecological at the King's College Hospital in London and a senior lecturer in physiotherapy at Brunel University in London. Angie, over to you.
Good morning, and thank you very much for inviting me to come and speak today about the impact of cough on urinary incontinence. It's urinary incontinence as a whole has always been a taboo subject that people rarely speak about, but we have more and more emerging evidence about the increased burden and impact of urinary incontinence in those with chronic cough. So what I'm hoping to do today for people is just to talk a little about what is normal bladder function and what happens when things go wrong. Look at tips and tricks for good bladder health and consider when to seek help for those with a bladder condition or a bladder problem. Now, I have to apologise that a lot of my anatomy and physiology is all very much designed for women because I specialise in female, but a lot of the treatment options that I will be speaking about are also relevant to the gentlemen listening, and I will make sure that I provide the appropriate resources as well. So when we think about our very basics, urine is developed in the kidneys and it travels down the ureters into the bladder where it is stored. The bladder's sole function is to store urine until it is a point where it is so socially convenient to be able to go and empty your bladder, and the urine comes from the bladder through the urethra and out of the body. But although that mechanism may feel quite simple, there's actually far more behind it. We have the pelvic floor complex, which is a complex of organs, muscles, connective tissues and nerves. And in women, the function of the pelvic floor is to promote bladder control, bowel control, to support all of the pelvic organs and for sexual function. And in men, there is also a pelvic floor complex that is involved in all these aspects. And the pelvic floor muscles alongside this are also supported by sphincters and a whole coordination of nerves and brain processes. So the actual process of emptying your bladder is far more complex because it involves on the brain, the nerves, the spinal cord, your bladder muscle, your pelvic floor muscle, or the valve of what we call the urethral sphincter. So what happens is as your bladder fills up, there are special receptors in your bladder that sends a message up to your brain to say that it's starting to fill. What that does is send a message back down to tell your urethral sphincter to contract and be tight so that it holds the urine inside. And it also makes you contract your pelvic floor muscles to be able to store that urine and stop leakage. When you're ready to empty, it sends a message to relax your muscles, relax your sphincters, and for the bladder muscle to contract so that the urine can come out. But any problem that affects either the nervous signaling up and down to the brain or can affect how your bladder functions, but also any inability or weakness within your pelvic floor muscles or sphincters to be able to contract and hold it in, affect the ability of your bladder to store urine without leaking some past. And this is where the impact of chronic cough comes, because it can affect the strength of the pelvic floor muscles and your ability to contract sphincters. So when we think about the types of bladder problems, most commonly in those with a chronic cough, it would be an issue with leaking when you coughing. So we ask people, so, do you sometimes leak when you cough, sneeze, laugh or exercise? And we often refer to this as stress incontinence because it's associated with an increase in pressure rise in your tummy that puts increased pressure on your muscles and they become less effective. But we also have to remember that there are several other bladder problems that can also affect patients. So we would ask, do you ever get a sudden desperate desire that you have to go rushing to the toilet? Do you sometimes leak before you get to the toilet, or you don't quite get your clothes off in time before you can sit down? Do you feel that you empty your bladder more often than others? If we think about the realms of normal, it's normal to empty your bladder anytime between 6 to 8 times a day. And it's normal to empty your bladder potentially up to once a night. So the other question would be, do you get up more than once a night? Now, we often know for those with chronic cough, one of the coping mechanisms is to drink more at night, particularly if you start coughing overnight. And then if you drink more overnight, you're then going to be woken up to empty your bladder more. We also want to look at whether you get pain when you pass urine or urinary tract infections, or whether you have to feel like you're straining to empty your bladder. And often in men, particularly once they hit sort of 50s and 60s and there are issues related to enlargement of the prostate, this tends to be more the symptoms that they may be experiencing. And the reality is bladder issues are a huge issue across Europe, even before we consider impact of chronic cough. Recent statistics show that there are about 60 million men and women across Europe with some form of bladder disorder, be that incontinence, urgency, frequency. And when we talk about incontinence, there's an overall definition that it's the complaint of any involuntary loss of urine. And there are many different types of urinary incontinence, all of which have slightly different histories as to why they occur and have slightly different treatment associated with them. But if you look at the background prevalence across the whole population, up to 46% of people may develop urinary incontinence at some point in their lifetime. And just as Kaylee's shown about the impact of chronic cough on quality of life, we know as a background on the impact of urinary incontinence of quality of life, it can affect men and women in many different ways. It can have physical limitations, stopping them doing physical activity, things they want to do. There's a massive psychological side of things because they lose self-esteem. They fear they're becoming a burden. They fear that they smell. They don't want to go out in case they have issues because they don't want to worry about having a problem at a friend's house or wetting someone's chair. They limit travel because they don't know where the nearest toilet's going to be. There's a huge domestic impact because they often have an increased financial burden as they're buying special clothing, bedding, pads. We know that there's a significant impact on work, and we have really good impact on increased absenteeism from work and decreased work productivity because of the impact of urinary incontinence. And it has a massive issue with regards to relationships and avoidal of sexual intimacy and aspects. So on all aspects of quality of life, we know that it has an impact. One of the research that we've been doing recently in between the urogynecology and the respiratory services at King's is looking at the impact of chronic cough and incontinence on quality of life. So we've been comparing women with stress incontinence with women with stress incontinence and chronic cough. And we actually find that there is an increased burden, not only in what they're paying for pads, but a worsening function on chronic cough when they have both conditions. And this is represented because of the increased prevalence. I said about 46% of women may develop stress incontinence. In those with chronic cough, those statistics go up to about 63% of patients. So there is an increased likelihood of having incontinence against the background population. So what can we do about it? And there are simple health promotion aspects and general aspects that can significantly help improve bladder symptoms. And the first thing that's always recommended are lifestyle interventions. We know weight loss is a challenge for lots of different people around the world. But from a bladder point of view, we know that in women that are obese and overweight, a weight loss of up to 10 kilos can halve the amount of urinary leakage that they experience. So one of the first things we try to do is to encourage people with weight loss. The challenge there is often in trying to get weight loss, it's then about increasing physical activity. But if that physical activity, A, triggers your incontinence or triggers your chronic cough, we're then in a bit of a vicious cycle as to how we can help. Excuse me. For those that are smokers, we know that smoking cessation has a significant impact. And interestingly, it's not only from impact of cough, but smoking, nicotine has an impact on the bladder. Nicotine can cause contractions of your bladder muscle and can increase symptoms of an overactive bladder. We work at dietary modifications, fluid modifications, which I'm going to talk about, and managing bowel health, because within pelvic health, the bladder and the bowel are very much interlinked, and problems related to bowels and constipation significantly worsen bladder symptoms and increase urinary incontinence. So when we think about fluids, there are lots of different challenges with fluids because there are many drinks that can irritate the bladder. So we know traditionally that anything that is caffeinated, anything that is carbonated, and anything that is artificially sweetened are irritants to the bladder. Not only do they irritate the lining of the bladder, but they also affect the way and the speed at which you produce urine. So they make you need to go more often and more frequently. So the worst case scenario is things like Diet Coke, because they're a triple whammy of badness, because they're caffeinated, carbonated, and artificially sweetened. We need to think about hidden caffeine, things such as hot chocolate. Green tea is terrible for the bladder, and acidic fruit juices are also known to be irritants to the bladder. So we look towards the more non-irritating fluids, your decaffeinated drinks, your water, your diluted juices, most herbal teas, with the exception that anything that is sold as a detox tea, because the way in which detox teas work is to encourage you to produce more urine. They will have a diuretic effect to flush you out. So they will make you pee more and have more problems with your bladder. The biggest challenge is actually within the volume that you drink. And it's very difficult for me to sit here and say exactly how much you should drink on a day-to-day basis, because it's going to depend on your height and weight. It's going to depend on other medical conditions you have. It's going to depend on which part of the world that you live in, what the climate is, what your levels of physical activity is. And when you see a bladder specialist, they will work on a process of identifying the ideal amount. The challenge that we often see, that a common coping mechanism in chronic cough, is to drink more to try to suppress a tickle. And the more you drink, the harder your bladder has to work, the more leakage episodes you're going to experience. So again, it's about trying to work on those challenges that our first thing for any woman with a bladder condition would be to look to reduce fluid, but it's how we do that in line with other symptoms. And often there are dry mouth moisturizers that are available for people to buy to try to help with that. The next most important thing is about maintaining and promoting the strength of your pelvic floor muscles, because they are ultimately what is helping you with your continence mechanism. Now, when we teach people how to do pelvic floor exercises, people understand in different ways, and I'll show you some resources where you can see videos of what to do. But what we want you to do is either to imagine that you are stopping the urinary flow, or imagine that you're in a lift and you have wind and you need to hold that in. The pelvic floor muscles is like a hammock. It goes from the front at the pubic bone all the way around the back to the tailbone. And particularly for women, sometimes if they're a bit older, if they've had children, trying to be able to feel the muscles at the front and stop the urine flow can be slightly more challenging, which is why we also give the advice that more people can have that sensation and feeling that they're doing it correctly from the back. The other way that has been described to women, and people work in all sorts of different ways, is to imagine that you're sat in a bath of eels and you're trying to stop anything going inside and squeeze in and hold them out. The main thing that we no longer want you to do is we do not want you to go to the toilet and try and stop mid-flow. That was the advice that used to be given out many years ago and is no longer correct and can lead to other issues. So don't try and stop mid-flow. It's about imagining you're stopping. And what we need to do is there are two different types of muscles within your pelvic floor, and we need to work both types of muscle fibers to get the best results. When you are looking at that moment of when you're going to cough, you need to engage your fast twitch muscles. So these are the ones where you're going to do short, sharp contractions. So you're going to squeeze your muscle in and out and in and out and work on engaging them quickly. So when you have that first start of a cough, they help you control that cough and that sneeze, or when you're lifting and pulling and pushing. But your pelvic floor as a muscle gets tired throughout the day. In the same way, if you're standing up on your feet all day or walking around, your back or your feet ache, your pelvic floor becomes more tired throughout the day. So you need to do muscle squeezes where you pull in and you hold that exercise. So you pull in your pelvic floor and you hold that contraction for 5 seconds, 10 seconds, 20 seconds. And they work on your endurance of your muscles. Now, yes, we teach them to hold on for urgency and to prevent prolapse, but ultimately they're the ones that are going to get you through the end of the day, because if your muscles are worn out by the end of the day and your worst coughing fits are at the end of the day or at night, it's the endurance muscles that you're going to need to work on to help be it not so bothersome later in the day. So how many should we be doing? Well, to do a full regimen, we should be doing at least 10 quick in and out and 10 slow contractions with holding. And you should do 10 of each, ideally 3 times a day to improve the strength you have, at least once a day to maintain the strength you have. And it is very much one of those aspects. In the same way that you may get up in the morning and you brush your teeth and you moisturize your face, it should be a daily activity that you do every day for life, with little mini top-ups during the day. It's about taking opportunities whilst you're waiting for the computer to load at work, whilst you're waiting for the kettle to boil, whilst you're brushing your teeth. You use that opportunity to do top-ups and to do that every day. And by linking it to daily activities, you start to bring it in with that. We also need to think about making this functional. Okay, the pelvic floor works differently and has to have a different amount of support and activity when we're in different positions. Nothing ever works all the time. When we're lying down, there's the least amount of gravity, the least amount of pressure, and they're doing the least work. When we're squatting in a position, they're having to work harder because of the position. But in order to make your pelvic floor exercises useful, we have to make it functional. Women can't predict. Not all women are just going to be coughing when they're lying down. They may cough when they're sitting at a table. They may cough when they're sitting at the desk. They may cough when they've got one foot up on a step. And the muscles work differently in each way. So when you're doing your exercises, you need to do them in different positions. Lying, sitting forward, sitting back, standing up straight, sitting on a corner of a table, toes turned in, toes turned out, toes turned forward, so that we are working all aspects of the muscle complex, but you're then able to engage them when you need to in a thing that we call the knack. And it's about recruiting the right muscles at the right time. So when you are recognizing that you are about to have that cough, you can then pull the muscles in, work on contracting them tighter to increase the level of support it's going to give your urethra and sphincter to reduce leakage. And that's the main thing that we teach to try and help when you're going to have that coughing fit. Now, what I do need to say about this is there is lots of information online. There's lots of videos that I will show you some resources, but 50% of women are doing their exercises incorrectly. And the best thing you can do is to see a qualified women's health physiotherapist to ensure that you're actually recruiting the muscles correctly to make sure that you're going to get the benefit from them. I just wanted to put something about gadgets, because as with everything, there are lots of things that people buy online. They see a gadget online and they think, oh, that's going to be amazing. I'm going to use that. That's going to do all the work for me, and I'm not going to have to use it. There are many gadgets out there that are designed to help you to do your pelvic floor exercises, to strengthen your muscles, to reduce leakage. But the reality is they're not right for everybody, and they don't take away from your own effort. They are really useful in someone who can't locate their muscles, that can't do that initial contraction, or when the muscles are too weak to effectively do it or to continue it. But they are not designed to do all the work. You're only there to enhance your own effort, and they are a temporary measure. So before you spend a lot of money on things, if you do go through a specialist physiotherapy service, most of these have things that are loaned to patients for a period of time for their use, rather than you buying these measures. When it comes to general bowel health, as I said before, constipation has a huge effect on urinary incontinence. And often what we see is by managing constipation, we then significantly reduce urinary incontinence. What we are looking for is for people to have a nice soft stool, like a type 4 coming through, type 3 to 4 ideally. And it's about an appropriate diet with appropriate fibre, fruits and vegetables. The challenge often is that for many people, they're on multiple medications, and it's the impact that medication can have on that. And so it's trying to then have an appropriate fluid intake, diet intake, or use alternative things to help with emptying bowels. And it's about positioning correctly on the toilet, because a lot of people are sitting incorrectly on the toilet. And there is a position called the perfect pee and poo position, where when we're sitting on a toilet, firstly, you should always sit on a toilet. If you hover over a toilet, you leave 40% of your bladder volume behind and will never completely empty your bladder, which can lead to increase in leakage. But by sitting on the toilet with something under your feet so that your knees are higher than your hips, leaning forward with your elbows on your knees and puffing out your tummy, that is called the perfect poo position, because internally it aligns everything into the ideal angle of exit and makes it easier to empty your bowels. So it's about positioning on the toilet to significantly help. For women and for men, we also need to be particularly aware of skin health. One of the most significant problems with significant urinary incontinence is the impact it can then have on the skin of the vulva and the perineum in men, because you can develop issues such as incontinence-associated dermatitis, where you've got wet pads or skin irritating the skin. Particularly for any woman with incontinence, but particularly for postmenopausal women, because of changes to skin health, we really do need to think about good vulval skincare, which is about washing with non-perfumed soaps, using some sort of emollient cream. And the British Association of Dermatologists have an incredibly useful patient information leaflet all about good vulval skincare. So for the women, I would really recommend having a read of that to keep skin intact, particularly with incontinence. And a final comment on absorbent containment products. The most commonly used coping mechanism for men and women with bladder symptoms is pads and containment products. It is an $80 billion industry in the US, because this is what people can go and self-help with. What we want to be clear is this is not the only option. This should be a coping mechanism whilst you are undergoing other treatments or an adjunct, but this should not be the only thing you are doing. Okay, there are lots of other treatments that we can provide to help so that pads aren't needed. The most important thing to remember, if you are looking at wearing pads, it must be a pad designed for bladder or bowel weakness. Many women may buy pads designed for menstrual periods to use for the leakage. But actually, menstrual period pads are designed to be changed every 2 hours, and they're designed to only soak up about 20 to 30 mils of fluid because that's the expected loss. And they don't always have something to take the wetness away from the skin. Most pads designed for bladder weakness have an absorbency of anywhere from 250 mils to 900 mils. So they have a massive, they are designed for larger volumes. They are also designed to take it away from the skin immediately and protect the skin. So if you are using containment products, please make sure it's one for bladder health. But please know that there are lots of other things that we can do so that this does not have to be your only option or coping strategy. So hopefully, the biggest issue is making sure you know when to seek help. Okay, when you have ongoing bladder symptoms, despite simple measures, you need to see a specialist service, be that a continence service, a urology service, or a urogynecology service. If, however, you have any symptoms of urinary tract infections, any blood in the urine, any pain, bleeding, or discomfort with sex, or anything like that, they are things that we would say, please go and seek help now. Now, I know within respiratory services, people are becoming increasingly more aware to ask about bladder symptoms when you're presenting with chronic cough, and many chronic cough services do now have links in to their associated colleagues in urogynecology, urology to provide ongoing symptoms. However, if it's becoming bothersome, please do come and seek help with us. So finally, for the women in the audience, there's an incredibly good website called yourpelvicfloor.org. And this is the patient-facing website of our International Urogynecology Association. They have leaflets about pelvic floor exercises, stress incontinence, bladder retraining, managing constipation. And most of these leaflets can be downloaded in about 20 different languages, so in your native tongue. There are also videos on there on how to do your pelvic floor exercises. For the gentlemen in the audience, the European Association of Urology have patient information leaflets designed specifically for the gentlemen, and they will have information about pelvic floor exercises for the gentlemen and the variations that they need. So please do start on the simple measures, but please do come and seek help, as there are other things we can do to help. Thank you.
Thanks a lot, Angie. It has been really sorry, I was muted. Thanks a lot, Angie. You have done a really great job on explaining how to manage the urinary incontinence, and I think it's an embarrassing sometimes for youngsters. I think even the older generation, they also have this problem, and you talk about it so naturally and it flows, and it was really nice to have some information about it. Thanks a lot. And now we will welcome the speakers back to the question and answers. We haven't got so many questions, but there was a question for Kaylee in the chat instead of the question and answer. That was asking for the percentage, but he didn't put what percentage of what. Do you remember anything about that, Kaylee?
So I spoke about a couple of percentages. I think if they want to pop it in the chat again, what specifically they're asking for, I can answer it in the chat.
I just want to thank to Angela once again. It was so wonderful. I didn't realize that when I ask my patients to drink every 5-10 minutes a little bit, I just worsen their condition with the stress urinary incontinence. So that's so simple, but I didn't write about it. Could you just find or suggest any solution? What we should indicate, how we should advise patients to drink not so many, to limit the volume of water, or do we rather should insist on drinking as much as possible during the day? What would you suggest?
It's really challenging because it has to be individualized to that person when their symptoms are the most bothersome and any other health conditions. For a patient coming to me that doesn't have a chronic cough, that is of a normal sort of, you know, an average 65 to 70 kilogram woman in a temperate climate, I would be advising that they don't drink more than 1.5 to 2 litres a day in total of all of the fluids that they're drinking. So tea, coffee, water, juice, milk on the cereal is all included within that fluid intake. And if they were bothered by getting up to the toilet multiple times at night, I would generally be advising to stop all fluids for 2 to 3 hours before they go to bed. However, for many patients, that doesn't work, because if they've got chronic constipation, they need to drink a bit more to then not manage the constipation. It's which is worse, having to pee a bit more frequently during the day, or having the chronic constipation that worsens the cough. For other patients, if they're particularly having significant issues with coughing at night, not drinking for that period of time. Now, the advice that you said actually of having small and often is far better. If you drink a large volume of fluid in a short space of time, your body can't process that very well. So 20 minutes later, your bladder will be full, and then it can cause you more problems. So having smaller amounts keeps you better hydrated. You're not producing urine as quickly, and then hopefully maybe not having as many issues. But it's that if you have a sip every couple of minutes, it's the cumulative total. So for a lot of women, we look at dry mouth moisturizers. There's a whole variety of products out on the market. There are mouth sprays, lozenges that you suck, toothpastes, mouth gels that you rub in your gums, mouthwashes. But I understand for the chronic cough, if it sits a bit deeper down and that sort of it's that resolution, we don't have an ideal yet. So it's about finding that individualized medium. And it may just be to try to slightly reduce the volume, but then also stop all the irritants as well, because it's the then added impact of what it is you're drinking that can add to problems.
There's a couple of questions on the Q&A. Firstly, an anonymous questioner wants to ask of the attendees, is anyone's cough here very constant? I'm coughing every few seconds. The tickle is there constantly. It doesn't go for short periods. Certainly my cough's been like that in the past. Sandeep, I don't know if you've...
I have cough whenever I laugh or whenever I move, but I don't have the tickle. When I do have the tickle, sometimes because my throat gets irritated by the cough, I normally have a lot of caramels, so candies. I'm a candy person nowadays. A lot of water, and try to breathe in as slowly as possible and breathe out. That's the only way not to get nervous. But normally the situation, depending on whether you're getting attention or not, it's difficult to do it. But it helps a lot normally. So, is there anything you would like to add, Angie or Kaylee or Martha, because you are the professionals here?
But I think chronic cough is very individualized. You will have patients that cough all the time, who cough thousands of times a day. You will have patients that maybe cough less. What we can't do is measure the impact of cough by how often patients cough. That isn't a measure of the impact. What we need to be doing is looking at them in a more holistic way. Because actually you can have patients who cough less, who have really severe bouts of coughing that may only have those 2 or 3 times a day, who every time they cough are incontinent. They may feel like they're going to black out or pass out. So I think it's It's and we need to make this, it's very individualized. So not every patient we see in the clinic will be the same. Some will cough more, some will cough less. And we absolutely cannot measure the impact by how many times they cough per day.
I agree, but for the person who keeps on coughing every few seconds, I guess that the urge to cough is very severe, and it just shows that the cough hypersensitivity is high. So we believe that for such person, the non-pharmacological methods of reducing urge to cough are very important, and there will be a special talk about it in the second part. And I'm afraid that we are a little bit short of time. We hope that during the second session we will have more time for the Q&A. We invite all attendees to ask questions, because as we repeated, there is no silly questions. That's a great opportunity to ask such questions and try to find the answer.
So yes, thanks, Marta. We're going for a break now for 5 minutes. So